Welcome back to Lovin Daily, and with me now is Nigel Camilleri and Etienne Muscat, two consultant psychiatrists. How are you?
Good morning.
So there's been a little bit of an issue at Mater Dei recently, right? The psychiatric services have suddenly been removed without any explanation. What's the issue over there?
Yes, I think that is just one example of psychiatry or mental health in general being identified or being taken to be the Cinderella of medicine for a number of years. The ministry came out saying that there was a plan for this and it was discussed. However, a transitional service, a transition requires informing and transparency with the patient, having a plan put in place with the patient, meeting with staff from the outpatients and moving to your new service with a plan. I think taking the broader, that is just one aspect of it. Looking at it broadly, psychiatric mental health services in Malta in 2020 do not meet standards, any European standards. And I think it is unfair on the thousands of people, 1 in 4 people will suffer from a mental disorder throughout their life. It is unfair that there has been no budget, or there hasn't been a good enough budget to change for a massive overhaul of services. So at present, in keeping with what happened with oncology, there is need for a massive overhaul, and this cannot happen. We're aware of the mental health strategy plan. Yes, it's a 10-year plan. However, what has happened till now? Why? So those 6 million allocated per year, where is that money going? What structural changes have there been to Mount Carmel? How are we increasing the amount of staff within mental health services? Okay, it needs to happen today and not in 10 years' time.
So you say that our services are very much under par, and now apparently they've taken even a further hit, right? So there were services that were offered at Mater Dei, and now they're being offered at community centres instead, right? What's the issue over there?
I'm going to just take it aside because, as you said, Nigel and I are both consultant psychiatrists. Our paths have now diverged. I no longer work with a government service, and I came because I think it's important also to understand that public-private in this field is a hugely important thing to understand. That I would say half the people who are seen and who are followed for mental health issues are not actually participating in the government public service, right? But all the issues remain the same, the principles remain the same, because ultimately, and there's always a to and fro of people seeing private and needing to go to the government and come back. So this to and fro remains. So things that send shockwaves into the government service also affect us in private service too. I think that is important to them. And I think that the safeguards that are put in place are important because they safeguard national patients as much as they safeguard also private patients. So I think these are hugely important things to consider. As Nigel said, mental health is a massive sort of part of reality of our country. And therefore things such as the role of the Commissioner for Mental Health, things such as the decency of a decent level of services available, these are all critically important even for my
Isn't it a good thing though to move mental health services out from a hospital setting and into a more community-based setting?
If there was a plan, there would be some sense. However, the mental health strategy plan meant that we were moving out of Mount Carmel towards the community and also to be part of the general hospital. So psychiatry is part of physical health medicine. There is an interface and there is an overlap, and there is importance in that. So having access within the general hospital is extremely important, because someone does not just get suffer from depression or anxiety or schizophrenia. He or she might also have diabetes, and you might need help in both areas, and you get it within the general hospital. Now, the ministry are working, okay? They are working, and they have promised us 4 new rooms within Ormy Health Centre. However, 4 new rooms in Ormy Health Centre are crumbs. They are not going to cut it for the thousands of patients who are left without an appointment. I guess it is the communication of transparency. It is the absence of resources, so the country needs at least probably 3 new community mental health clinics. And there still isn't a mental health clinic available for those living in the centre of Malta. So those people living in San Juan, Slema, St. Julian's areas, going wider than that, will have to go to Ormi Health Centre instead of Mater Dei. The problem is now that they have to catch 2 buses rather than 1 bus. So access to services has changed. And lastly is the voice of the patient. Has the patient been consulted? On the way here, I was on the phone with one of the key people from Mental Health Alliance who represent the patient group, and they are receiving repeated phone calls that actually their appointments are just being postponed and postponed and postponed, and they don't know what is happening to them. Yes, we're aware these are slowly being moved into community mental health services, but these are inundating the workload of community clinics. Therefore, we need many more clinics, we need an increase in staffing, and we need active change.
I think very important, because it's almost ironic. I hope we're not coming across as suggesting that we are against the transfer of care from inpatient to outpatient. That is what our battle cry has been all along. We absolutely need budgeting ratios to be reversed so that the bulk of funding goes into community and not in hospital. We want people out of hospital. If possible, we don't want anybody in hospital, and we have guarantee by the government that they won't build a new hospital because the current one just is not acceptable.
They've been talking about this for a few years now.
We have their word that it is going to happen on the footprint of Mater, which is what we've been insisting on, and we've been insisting on this because this is what the patients want. It's not just because of what doctors and nurses want, what the patients want.
Is there any update though? I mean, like they've been talking about this hospital.
I have no update. The point is apart from making it into something which is at least approachable and at least acceptable, and at least, I know, appearance-wise is not off-putting. At least it would shrink the amount of beds available so that we would have to force people into the community, because people need to be in the community. We are not against transferring people into the community. What we are against is hijacking COVID, using COVID to hijack mental health services and abruptly close off all access to, say, the psychiatric unit and Mater Dei. That's what we're against. We're against this abruptness of this lack of planning. Of course, we want to get to a place where people are in the community, but not by suddenly shutting things off so that people are freaking out because they don't know what to do. That's what we don't want.
Can you expand on this? What do you mean by using COVID as an excuse to hijack?
Because well, again, we're getting into the national health sector, which I wanted not to talk about, but this is important. I don't want to not answer your question. So, with the restructuring of Mater Dei's wards due to in preparation for the expected tidal wave of COVID patients, the psychiatric unit in Mater Dei was shut. So, not only was I guess little thought given to people with psychiatric problems, there was no alternative. There was no thought that perhaps people are going to struggle even more. We need to increase the access to people who have mental health problems, people with psychiatric issues. Instead, they just shut it.
But it's unbelievable, right? Because, I mean, due to COVID...
From my point of view as a psychiatrist, this is wrong.
Especially this with regards to COVID, because obviously it's disrupted many people's lives, so one would imagine that mental health problems will probably have increased during these times, right? And you're going to reduce the services.
They have increased. Mental health is a public health priority, should be a public health priority. It needs to become a public health priority. There needs to be a budget, and a proper budget allocated to it. And yes, there have been changes. The ministry has brought on a new CEO, has brought on a lot of energy, but you cannot have one person and 4 rooms to cater for thousands of people. We need a massive overhaul of the service from top to bottom, with management, adequate staffing and training of the staff who's already there. You can't burn out staff who's working within community mental health services, because we've redeployed to the community, is what the ministry said, which is true, but we can't burn out these few psychiatrists in the community, and at the same time we cannot deplete the specialist services. So what is happening to old age services, to addiction psychiatry, to forensic psychiatry, which to me I'm not even sure there is much of, to child mental health. Child mental health outpatients is still based at St. Luke's Hospital. Why hasn't it moved out? There was a budgetary measure for it to move out. Why is it stuck? So something in the system is not working, and it is not acceptable in 2020 for mental health services to be in this place.
So basically the idea is good overall, but the logistical aspects of it just defeated the purpose entirely. Then.
The goal of moving to community services is not just good, it is good. It is, I mean, well, we should all be following. We have to get into the community. We have to structure our services such that people access, get, and follow up help in the community. Pero it has to be done. I agree with it done fairly rapidly, but rapidly is not abruptly without. You do it and then everybody runs around to see how they're going to sort themselves out. That is not prioritizing mental health. That is not looking after the interests of people with mental health issues. And in this, I think it is important to realize that according to the Mental Health Act, the law governing mental health, the person tasked with safeguarding the patient's role and the patient's right and the patient's, all that involves the patient, is the Commissioner for Mental Health. There is, however, a slight issue, I feel, with the way the Mental Health Commissioner Act sort of is set up, which is that the Mental Health Commissioner is actually answerable to the Minister. So unfortunately, the people he is policing or he is protecting are actually, he's engaged by the same person who he's supposed to be monitoring. So obviously we have a big problem there, because what you could end up with is a situation where the commissioner ends up becoming a PR for the ministry and not, I'm sure nobody's going to accept that they're going to admit that this is actually happening. I'm sure that this is not what anybody wants to happen, but I mean, we're all human beings. Mm-hmm. And if the person you are supposed to be vetting is the person giving you your job, it's a problem.
Just to close this discussion off, these are a lot of very pertinent points have been raised, but in terms of the short-term measures that can be taken right now to improve services, what can be done imminently to make sure mental health people suffering from mental health problems have access to better services?
3. Structure. So there's 6 million a year for 5 years promised. Where is that money going? Where is it being invested? You can do a lot with 6 million. Why isn't there a community mental health service in the central part of Malta? Okay, that is 1. 2, staffing, encouraging staff, so bringing on adequate numbers of staff. We still have a crisis team in Mater Dei, which is manned only by psychiatrists. There isn't a full multidisciplinary team present. And the last is training. You cannot have staff present there without regular, continued professional development. I think that is it. And maybe the ministry showing us a Gantt chart of the plan for 2020 to 2030. Yes, as Dr. Etienne mentioned, there is a goal, but what is the Gantt chart? The ministry says they're up to date till today. What has been done in practice till today?
And you?
Well, I think we should stop on this point.
Thank you very much. Thank you, Etienne. Thank you, Nigel. That's all for us from today. I urge you to follow our website, lovinmalta.com, for more updates on all of these stories that we discussed today. And until then, have a day full of loving.